Well, I want to talk about gluten intolerance today. It was even on one of the network TVs. They had a whole big thing on gluten, and all the movie stars and athletes were affected by it. And right now, according to, actually it was 2009, according to Mayo Clinic, a big international clinic in Rochester, Minnesota, they said 30 out of 100, just about one-third of Americans are gluten intolerant. Now, we're talking about 115 million Americans, a huge market, 115 million Americans, and you're looking at 30 million baby boomers are gluten intolerant. And then when you look at certain cultural or ethnic groups, the Seventh-day Adventists are 80% gluten intolerant, the Mormons are 80% gluten intolerant, and the Amish are 80% gluten intolerant because they eat so much grain. Now, I urge you to get a hold of my CD called Cereal Killers, spelled C-E-R-I-A-L. It's a contraction of two words, cereal, like C-E-R-E-A-L, the cereal you eat for breakfast, and then cereal, S-E-R-I-A-L, like serial killers, people who kill people every week kind of thing. So once you get a hold of that CD, Serial Killers, once you get a hold of the book Hell's Kitchen, and that'll give you a lot of references, it'll give you a lot of information we just don't have time for in this monologue. But it's a serious problem, and not only do you get from gluten intolerance, it's not an allergy to wheat. When you're gluten intolerant, you're actually sensitive, you're intolerant of wheat, barley, rye, and oat proteins, not in an allergic fashion. You don't get the same biochemical activities that happen when you have an allergy. It's kind of like more like a contact dermatitis when you roll around naked in a patch of poison ivy. You're not allergic to poison ivy, but you sure are going to be intolerant of it. Well, the same thing that happens when you eat gluten from wheat, barley, rye, and oats, or drink it in beer, scotch, and bourbon, or any other alcohol drinks, or any drinks that are made from wheat, barley, rye, and oats. Your intestines are going to look like you've been eating poison ivy for salads. And so a lot of doctors will call this leaky gut syndrome. And a lot of people will get called celiac disease. It'll be called irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, appendicitis, diverticulitis, Crohn's disease, the most severe form, where they want to start amputating chunks of your intestine. They will take out your appendix, they'll take out your gallbladder because of belly pain. Colicky babies have the symptoms. And then secondarily to this, you can get any one of hundreds of diseases that are nutritional deficiency disease, because when your intestines change negatively like this, it reduces your ability to absorb things by as much as 80 to 90%. And you get all these diseases. You might have 25, 30, 40, 50 diseases, all caused by malabsorption of nutrients. Of course, the doctors say, well, you have an autoimmune disease, your body's attacking itself. You have a genetic disease, which is passed on from generation to generation. Of course, gluten intolerance is passed on through women, not through men. It's not a genetic thing. So men don't contribute to passing it on, but they can get it from their mother, either through cord blood or through breast milk. Same way with girls. The girls pass it on because they will expose the embryo to cord blood, of course, and then they expose the embryo or the newborn baby to breast milk. So in either case, they're going to initiate gluten intolerance in the embryo or the newborn baby. So this is something you have to be aware of. So some of the more common symptoms that people get or diseases they get when in the earliest stages of gluten intolerance, we're talking things like colicky babies. Take the baby off the breast milk and you put them on a formula. Hey, boy, they're happy because they're not getting the gluten through the mother's breast milk anymore. And then they start eating solid food again. Then they start getting belly pain. They don't want to go to school. And you think, oh, the kids, as a teacher being bad to the kid, the kid's got belly pain. Mommy, I don't want to go to school. My belly hurts. The doctor takes their appendix out. They get a little older, they'll take their gallbladder out. Get a little older, they want to amputate chunks of their colon and their small bowels. And then you begin to gain weight because you're hungry all the time because you can't absorb minerals. And so you have pica and cribbing and the munchies because you're minerally deficient. And so you start eating more and more and more, and you can't absorb sugar and calories. As a result, it's not unusual for people who have gluten intolerance to be overweight. It's not always, just like always people who are overweight don't get diabetes. Just because you have a gluten intolerance and a malabsorption problem doesn't mean you're necessarily going to get overweight or stay thin. So it could be 50-50. You may have some people in your family who are overweight and some who are very thin, and they all have gluten intolerance. Then asthma is a very common result of gluten intolerance because the large fatty particles, things like essential fatty acids and cholesterol that are necessary to make the prostaglandins to keep your bronchi open, these things cannot be absorbed. and you can't manufacture the prostaglandins properly without the omega-3s, 6s, and 9s, the proper ratios. As a result, you get a high rate of asthma in people who are maybe chronic bronchitis or chronic colds or susceptibility to pneumonia every winter. Because during the wintertime, you're eating more, waffles and pancakes and toast and oatmeal and that kind of stuff during the wintertime. So it tends to be worse. People say, it's the dry air during the wintertime. No. You're going to get skin problems, eczema, dermatitis, psoriasis, rosacea on your face, very typical of alcohol drinkers. They get rosacea on the face. And there's an ad where this guy with rosacea all over his face, he was kind of a chunky, geeky kind of guy, really maybe 50 pounds overweight, being kissed and loved all over by this beautiful drop-dead poster girl, cover girl. And she's just loving this guy, and he's just covered in rosacea all over his face because he's got a gluten intolerance. Now, they don't know that. They just think he's a geeky guy with rosacea. Well, stick with us. We're going to be back with more truth, justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
Do certain foods cause you to bloat or experience gas? Do you wake up in the middle of the night with heartburn? Are you forced to sleep on piles and piles of pillows to cut down on heartburn? Have you been diagnosed with acid reflux or gastroesophageal reflux disease? If any of these describes you, then you've got digestive problems. I was awakened with heartburn almost every night for over 20 years. Then I heard Dr. Wallach and realized all of the antacids I'd been using were actually part of the problem. My stomach acid wasn't too strong. It wasn't strong enough. So I started taking the ultimate enzymes from Longevity. Now all of the heartburn, belching, and bloating are gone, and I can sleep through the night without piling on the pillows. And I'm back to eating the spicy foods I love. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
In recent years, several studies have discovered the health benefits of drinking coffee. Longevity has now taken it a step further with an entire product line of healthy coffees from Longevity's JavaFit selection of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium hand-selected Arabica coffee beans grown in the finest regions of Latin America, all carefully roasted, creating a delicious, rich, full-bodied flavor. Try JavaFit's Immune Plus, a full, robust coffee blend combined with the immune-supporting benefits of echinacea and the full-spectrum daily requirement of vitamins and minerals. Boost your immune system every day with JavaFit's Immune Plus multivitamin coffee. Available in 30-count single cup or 24-count single pot packs. Contact your local Longevity distributor to get Javalution coffees. And don't forget to ask about the home-based business opportunity.
Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about living longer, as I've got a story here from ABC News where it's headlined, Baby Boomers Living Longer, Not Healthier. Say, although they're living longer than previous generations, they're not necessarily living healthier lives. And, of course, that requires one of these. Because you've been talking about that for a long time, about how these baby boomers have all these epidemics of heart disease and diabetes and obesity headed their way.
Alzheimer's.
Yeah, all because that they are buying into what their doctors have told them. They say men and women born between 1946 and 1964 more likely to suffer from high blood pressure, high cholesterol, and diabetes than generations before them. This is all published in the Journal of the American Medical Association's Internal Medicine. And they also say that you're also more likely to be obese and less likely to exercise. And they say despite their longer life expectancy, baby boomers have higher rates of chronic disease, more disability, and have lower self-rated health than members of previous generations at the same age. They say on a positive note, though, baby boomers are less likely to smoke cigarettes and experience lower rates of emphysema and heart attacks than previous generations. A study supports a gloomy forecast for healthcare costs, and of course, with this Obamacare thing that's going to be burdened onto our government as all these people go into Medicare and Medicaid, and they say as they approach their 70s, Americans spend roughly $147 billion a year on obesity and $177 billion on diabetes. This comes from the CDC, and that totals up to $324 billion spent on just 2 diseases that are
That's a
actually
third of $1 trillion.
yeah, and that's actually these things are preventable and reversible if you just do the right things. But of course, in this article, they go, well, it's never too late to turn things around. You could change your diet, and exercise is important as we get older. It's never too late to quit smoking. They say exercise doesn't have to mean Olympic training. Easy things people can do like walking and swimming and gardening and any kind of physical activity. Whole article, not one mention of supplementation on how you can reverse most diseases by just supplementing with the Mighty 90.
Absolutely, and again, I urge people to get a hold of the book Dead Doctors Don't Lie and get a hold of this concept, which actually came out 65 years ago. When I was 9 years old, I figured it out, and I guess if you're biblically oriented, you might say, well, how can a 9-year-old figure all this out? So there may be a divine appointment here, and basically, you have to carry the Garden of Eden around with you. Of all the places on earth, again, if you're biblically oriented, why did the good Lord pick the Garden of Eden to put Adam? Well, it was a small garden, had everything in it, but we all can't go there. 7 billion people, let's assume it's true for a minute, we all can't go to the Garden of Eden. There's 7 billion people. It was meant for one man, and so we have to take that knowledge, which has to do with what made that place special. Well, there were 4 rivers dumping in there from the mountains, surrounding mountains, and they brought silt, which are minerals, and we're constantly refertilizing that valley. It's called the Fertile Crescent. That location is still there today. It was the first MapQuest. If you kind of read it in the Old Testament, even if you're not a believer, you follow those rivers. They're still there, and so you know exactly where the, if nothing else, legendary Garden of Eden was there, and still is there, and the rivers still dump silt in there. It's one of the most fertile places on earth. This is where agriculture started. And so basically we have to think, okay, what do we do to mimic that? Well, the only thing you can do is take that 90 essential nutrients, the Mighty 90, the 90 for Life program. And again, I like the Healthy Start Pack. It gives you all known essential nutrients plus 115 super juices. You heard it, not V8, but VF115. VF115. And you take all that, you stay away from the bad stuff, you're going to get everything your body needs and avoid things that hurt your body. You're going to maximize your lifespan. I mean, I haven't been to a doctor in 65 years. If everybody in America was like me, the medical system would be real humble. Let's think about making that happen, Doug. Well, stick with us. We're going to be back with more Truth, Justice, in the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Independence, Missouri. And Doug, you're on with Dr. Wallach.
Okay, Doug, you're on the air.
God bless you, Dr. Wallach. Thanks for all the hard work you do to get the truth out there about health. But, Dr. Wallach, I have a truck driver I met, and he has some real pain. He can't stand for more than even 5 minutes without real pain. He's 250 pounds. A lot of the weight is in his belly. In the winter, he has dry elbows and dry heels, and he had surgery done, decompression surgery, and obviously that didn't work. And the doctor's going to go in.
About his decompression of a disc in his back?
Yes, I'm sorry.
Okay, and then when you say he has pain, is it pain in his feet or what, back or what?
His back.
Okay.
Yeah.
Very good.
And now the doctors want to do surgery again, and this time remove some bone and do some fusion.
Okay, I would tell him to say no to the doctor.
Okay.
Okay, this is a no because we can help that fella. Basically, at 250 pounds, we have to treat him optimally as a 300-pound person. If the cost is a little over the top for him, he can treat himself as a 200-pound person. It'll take a little bit longer, okay?
Okay.
But I'm going to give you the program for a 300-pound person, and then you'll have to reduce it by a third. You cannot reduce it any more than that. If you reduce it more than a third, then he's not going to get much effect. It'll be too far underdosed, okay?
Sure.
So you need to get rid of all the bad stuff. He cannot be drinking carbonated drinks during meals, an hour before the meal, during the meal, hour afterwards, because it neutralizes stomach acid and it reduces the efficiency of absorption of minerals, B12, reduces the efficiency of digestion, particularly of proteins, okay? No fried foods, absolutely no fried foods. And no exceptions, absolutely no processed meats or nitrates and nitrites, no exceptions. We're talking about deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, all that kind of stuff. He needs to get off of all oils. his margarines, mayonnaise, salad dressings, cooking oils. If he eats canned fish, they got to be packed in water, mustard, tomato sauce, not oil. And because he has all this dry, cracked skin, this guy's got a gluten intolerance. And so I would also have him give up gluten, no wheat, barley, rye, or oats. He can stop at all these big box stores. They all have gluten-free aisles, and he can get gluten-free snacks and all this kind of stuff. But we do want him to watch portion control. I want him to eat eggs, poached eggs, soft scrambled eggs and butter, not oil. That kind of stuff for meals. Has to have animal protein with every meal. Got to stay away from all the breads and pasta because they're gluten. Hang on. We'll come back. I'll give you the rest of the story for this fella after these messages. Okay, Doug, we're going back to Missouri. And Doug, let's see here. Okay, we've gotten rid of all the bad stuff for this guy. Now, the supplement program is going to look like this. Number one, again, I want him to have 3 Healthy Start packs per month. Another way to do this would be 3 quarts of Ultimate Classic per month. Either one will work. There's a little more of the antioxidants in the Healthy Start pack. But anyway, either way would work. If you do the 3 Healthy Start packs, it'd be 1 ounce of the Osteo FX Plus at breakfast, lunch, and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast, lunch, and dinner, 3 of the EFA Pluses at breakfast, lunch, and dinner, and all that will be accomplished by the 3 Healthy Start packs. If you get the Ultimate Classic, it'd be 1 ounce of Ultimate Classic at breakfast, lunch, and dinner, so that's 3 quarts of that per month. And then you got to get the Extra OsteoFX Plus and give him, again, 1 ounce of that 3 times a day, so it'll be 3 quarts a month, and 3 bottles of the EFA Pluses, so you can have him take 3 of those 3 times a day, so one way or the other. Then I also want him to have 20 glucogel capsules a day. That's going to require 3 bottles of the 240-count large bottles of glucogel. I want him to have 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime with a glass of water. And this is to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And this is just a drop-dead predictable as gravity. It has the ability to do that. Then, does he have any high blood pressure or diabetes, anything like that?
Yeah, I forgot to mention high blood pressure. He's about 140 to 150 without medication. He's on medication, so like 130 right now.
Mm-hmm. Okay. Well, let's get him to lose some weight, and then I think his blood pressure come down and be able to get off that high blood pressure. So let's get him on, get him 2 bottles a month of the ASAP, because I want him to have 2 droppers full under his tongue 30 minutes before each meal, so it's going to take 2 of those little bottles per month to pull that off. It's liquid, 2 droppers full under his tongue 30 minutes before each meal. And be sure that he doesn't swallow that liquid. I want him to just hold it in his mouth. It'll absorb within 2 minutes through the tissues in his mouth into his bloodstream. And it's going to help him with portion control. It'll actually accelerate weight loss. These are obviously non-prescription, non-narcotic, that sort of stuff. And he'll begin to lose weight quite quickly. And that's going to help him with the blood pressure issues. But do call me every couple of weeks. I want to know his blood pressure. I want to know his weight. I want to know his level of pain. If I'd rather have him use our CM cream topically on his back, his joints, if he does have, if he's on any kind of medication. Even things like ibuprofen is bad for your liver. Tylenol is bad for your kidneys. Prescription drugs can be, especially if they're narcotics, can be addictive and certainly not something you want to do as a truck driver. And so, because of the hazards. And so this is an option that's safe. You can apply 4, 5, 6 times a day if he wants to, but you should give him pain relief for 3 to 5 hours. CM cream topically. Give me a call. We'll be back after these messages.
Let's head to Texas. And Jerry, you're on with Dr. Wallach.
Hello, Jerry. You're on the air.
I have a son that has Duchenne's muscular dystrophy.
Okay.
And he's been in a wheelchair for 7 years. He's still in he pushes himself. They try to put
How old is he? How old is he?
16.
Okay. How much does he weigh, sir?
About 110.
Okay. Now, does he have any skin problems? Eczema, dermatitis, psoriasis?
Eczema. really bad.
Okay, real bad.
Yeah, I mean,
does his mama have eczema, dermatitis, psoriasis?
Not sure. I don't recall.
Okay. Let's see. Does he live with you or with her?
With her.
Okay. Have you heard me speak about Jerry Lewis and the muscular dystrophy story?
Yeah, I heard that on Rule of Law Radio, and that ever since then I've been trying to talk to you.
Okay, good. Well, I'm glad you got me. All right. Yeah, we can help this young fella. His mother has to get on a gluten-free diet. If she has any other children, they've got to get on a gluten-free diet. Your son's name, what's his first name?
Sam.
Sam? Okay, great. Okay, so, yeah, Sam needs to get on a gluten-free diet, no fried foods, no processed meats with nitrates and nitrites, no oils whatsoever. And then I'd have him take one Healthy Start pack per month, give him a tablespoon of the Osteo FX Plus at breakfast and dinner, one scoop of the Beyond Tangerine at breakfast and dinner, the 3 EFA Pluses, I'd have him take one at breakfast, one at lunch, one at dinner. And then I would get him 2 bottles of our Ultimate Selenium. And I'd have him take 6 of those selenium a day, 2 at breakfast, 2 at lunch, 2 at dinner of our Ultimate Selenium. And would also get him to take the de-stress capsules, 2 bottles a month of the de-stress capsules. That's 2 at breakfast, 2 at lunch, 2 at dinner. That's 6 a day of them. And let's see here. I would also have him use the Rebound as an energy drink for himself. It has 100 nutrients in it. And he can get the little sticks and put the powder in a bottle of water or get the liquid concentrate, whichever one's more convenient for him. But the eczema is going to go away pretty quickly. Does he have any chronic respiratory problems like asthma, chronic bronchitis, anything like that?
No, he does have reflux.
Okay. All right. So what I would do also for that is to get him our what we call ultimate enzymes, and have him take one of those 2 to 5 minutes before each meal with a couple ounces of water. That's going to almost entirely get rid of the reflux. But I would also have him get our Ancient Legacy aromatherapy peppermint oil. And if he ever, has kind of a little, what should I say, upset stomach or heartburn or belching, burping, bloating, or reflux, even though he's taking the ultimate enzymes, it should be very rare if he has it taking the ultimate enzymes. But I would have him put 2 to 3 drops of that peppermint oil from Ancient Legacy in 8 ounces of hot water, like he's making a cup of tea out of it, and sip on that through the meal, and then whatever's left over, knock it down, just drink the whole whatever's left at the end of the meal, and within 2 to 5 minutes, all the symptoms will be gone, because the peppermint oil just works wonders for that kind of reflux. Okay? This sounds awful simplistic, but I want you to get him a couple of things. Get him that CD called Serial Killers, so he understands why he has to be on a gluten-free diet. And this is why he has muscular dystrophy. His mama couldn't absorb stuff very well. It's not a genetic disease, as doctors would have you believe. It's a very simple nutritional deficiency. We've eliminated it in the animal industry because muscle is meat, meat is muscle, and anything that afflicts the muscle of the meat industry, that's bad, right? So they figured out 50-something years ago, almost 60 years ago now, that muscular dystrophy, a.k.a. white muscle disease in calves and stiff lamb disease in sheep and lambs and goats, is nothing more than a simple deficiency of minerals. And you take these things as we've outlined here, he's going to show, first of all, his if he gets really drop dead on a gluten-free diet, his eczema will go away very quickly, and the reflux will go away very quickly, and then he'll begin to gain strength as his intestines heal and he's able to begin to absorb all this stuff. And watch what happens. This is going to be just really great. And he can start his own business, get him going. He can sell the Rebound as a sports drink. He can sell all the rest of the longevity products. And here's the beauty of this. How tall is he?
Well, we keep joking with him. We keep saying he's only so high because he's always in his wheelchair. He thinks he's probably about 5'9", maybe 5'10".
Okay, well, my goal is in the next 6 months to have him playing basketball. How's that?
Yeah. They've never been able to get him because he's been in the wheelchair for so long, he's never straightened out his legs. They never put him in therapy, so his legs are pretty much locked.
Yeah, well, he can start rubbing his own legs, and he can start moving his own legs. He doesn't have to go to therapy to do that. Okay, he can start doing it himself. All right? And even if he can't move his legs himself, he can take his hands and he can move his legs. Start moving them and start doing his own physical therapy. But I want him to get that CD called Serial Killers, so he listens to that, so he understands the importance. I want him to get the book Rare Earths Forbidden Cures, and he will see himself in that chair. He will see himself because we got pictures of kids with Duchenne's muscular dystrophy. We have the microscopic pictures. We got the pictures of the muscles that you can see with your naked eye. And we show kids with the enlarged calves. Does he have the enlarged calves?
Yes.
Yeah, they usually have enlarged calves and very thin thighs, and they don't have much of a rump. Well, all that will change, and when we get these kids, they roll around like logs. They can't stand up, and they can roll by using their head and their neck, and they can roll from one end of the house to the other. But usually after 3, 4, 5 months, they're up playing basketball. So that's my goal for him, okay?
Oh, that'd be fantastic.
Okay, well, call me, as often as you want. You can call me 10 times a day if you want on this number, but you'll get me. But just don't wait longer than 2 weeks. And then after he gets going on the program, I want to talk to him too, okay?
Okay, sure.
Okay, God bless you, sir. Let's go to work, and let's get Sam playing some basketball here.
That would be wonderful.
Okay, God bless you. Okay, Doug, Santa Cruz Doug. Let's go to callers.
Okay, let's head to Moscow, Idaho. And Sandy, you're on with Dr. Wallach.
Oh, Sandy, you're on the air. Hi.
Hi, thanks, Dr. Wallach. Here's my situation. About 4 years ago, I was diagnosed by my doctor with polymyalgia rheumatica, and he prescribed me to be on prednisone, which I've been on.
Okay, now I have to run to one of these message moments. I get the drill here. When we come back, I'm going to ask you some questions, and then I'll give you a program. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go right back to Idaho and Sandy. Okay, polymyalgia rheumatica is a kind of a cousin disease to fibromyalgia and lupus, none of which are genetic, none of which are autoimmune. They're just simple nutritional deficiencies. I just have to ask you one question here, Sandy. How much do you weigh?
202.
Okay, and how tall are you?
About 5'3".
Okay. All right, what I need you to do is give up all the bad stuff. In your case, it would be no fried foods whatsoever, no exceptions, no processed meats with nitrates and nitrites, no exceptions, no oils, no exceptions, and no gluten, no wheat, barley, rye, and oats, no wheat, barley, rye, and oats. Then this goes by body weight, so I need you to take 2 Healthy Start packs per month. That's 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine Nutri-Crystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All of it will be accomplished by the 2 Healthy Start packs per month. I need you to take 3 of our selenium twice a day, 3 at breakfast, 3 at dinner, and that's 2 bottles a month. And I want you to take 15 glucogel capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. That's 2 of the large 240-count bottles per month. Use the CM cream topically for pain. Call me every 2 weeks and give me an update, and I'll walk you through this, dear. Okay, Doug, let's go to callers.
Well, let's go to Michigan. And Mary, you're on with Dr. Wallach.
Well, Mary, you're on the air.
Yes. Hi, Dr. Wallach. Thank you for taking my call.
What's up?
I have some concerns about my husband, Roman. We both started with the Healthy Start packs last month, and but my husband, he has high blood pressure. Sometimes it's gone as high as 190 over 100.
Mm-hmm.
He also was diagnosed with sleep apnea last summer, and then 2 years ago he had double pneumonia, was hospitalized for that, and he developed pleurisy, which lasted for 3 months.
Okay, but he doesn't have active infection now, correct?
No, he just kind of got over it. He had a lot of lung pain.
Okay, we don't have a lot of time here. I'm going to encourage you to call me back tomorrow, but I'm going to give you something to start with here. He needs to get rid of all the bad stuff. No fried foods, no processed meats or nitrates and nitrites, no oils, no gluten, no wheat, barley, rye, and oats. I want him to take 2 Healthy Start packs per month. That's 1 full dose of each of the 3 products at breakfast, one full dose of each of the 3 products at dinner time. For the blood pressure, I want him to have 9 of our Ultimate Daily tablets per day, 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 2 bottles a month of the Ultimate Daily tablets. And let's see here. Then I want him to take the Killer Biotic. Sounds like he needs a little support for his immune system. I want him to take 3 of the Killer Biotic twice a day, 3 at breakfast, 3 at dinner. That's 2 bottles a month of the Killer Biotic. It's a blend of herbs, and also it has colostrum in it, which is the first milk from a cow after she has a calf just loaded with antibodies against viruses, bacteria, fungus, and yeast. And they actually cross-protect, whether the cattle, the humans, the cattle, and so forth. They actually cross-protect. It's kind of interesting. But anyway, sleep apnea. This is a fake disease. Sleep apnea is a normal behavior. Any doctor who diagnoses sleep apnea as a disease should be put in jail for insurance fraud. I truly believe that because sleep apnea is a normal behavior. And basically they have created a disease out of a normal behavior because you may have complained to your husband, say, you stopped breathing. So next time he goes to the doctor doctor says, well, I haven't seen you in a while. What's going on? Well, my wife says I don't breathe when I'm asleep. Oh, you got sleep apnea. Let's get a CPAP machine. I'll write you prescriptions. We're going to do some surgery. I need to see you every week. We're going to send you to a sleep clinic. Of course, the sleep clinic gives the doctor a kickback for sending him to the sleep clinic. And this is just a big mishmash and nothing. Nobody dies of snoring unless their sleep partner kills them. Nobody gets a heart attack from snoring. If you don't like the snoring, you either sleep in separate bedrooms. You make an appointment to get frisky. You can actually teach him how to sleep on his side with one of those wedge pillows, drink plenty of water before he goes to bed. And this all is corrected. You don't need all this machination about sleep apnea. There is no such disease. It's a normal behavior. And it's one of these terrible things that doctors have created a disease out of normal behaviors, like saying, man, you've got breathing. Well, yeah, no, it's a disease now, breathing. Oh, breathing is a disease now. Woo! Okay, well, thank you, everybody. Great questions and testimonies today. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
According to the CDC, nearly half of all Americans take at least one prescription drug daily. For those over the age of 60, almost 40% are taking at least 5 medications every day. Some of those drugs costing hundreds of dollars. Most people struggle to pay for these expensive drugs, but FDI Longevity has the answer with discount pharmacy cards. You can get a 10% and on some drugs up to an 85% discount. Up to a 35% discount on hearing aids, and up to a 60% discount on lab tests, even ones for your pets. This card never expires, and best of all, the FDI Longevity card is free. That's right, I said free. Imagine the change in your life with extra change in your pocket. All because you're saving hundreds, if not thousands, on your medical costs with your FDI Longevity discount card. Contact your local FDI Longevity associate and find out how you could get your free pharmacy discount card. And remember, it's free!
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. Fish has been thought of as a brain food for eons, but it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Youngevity has developed the perfect supplement in SmartFX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try SmartFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Youngevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.